Hello, I'm Dr. David Bull, and I'm here in Brussels for the launch of EUFOREA's first annual Global CRS with Nasal Polyps Awareness Day on this day, on the 20th of April, 2022. Now, what you've just heard are real statements from real patients with chronic rhinosinusitis with nasal polyps, or CRSwNP. So what exactly is CRSwNP? Well, it's defined as a chronic inflammatory condition of the nose and paranasal sinus cavities, and it has a major impact on the well-being and social function of those patients. Now, interestingly, it's greatest in young adults and those in the middle-aged population. So what's its prevalence? Well, it has an estimated prevalence of some 3%, and as you can appreciate, CRSwNP represents a common health problem in the Western world. Now, guidelines were produced, they were called EPOS 2020, but despite this, a substantial group of patients remain uncontrolled. And as they're uncontrolled, they have recurrent needs for oral corticosteroids and endoscopic sinus surgery. And there is a massive burden to this. The significant economic and clinical burden of CRSwNP highlights the need for better treatment options and, of course, reorganization of clinical care pathways. Now, a recent Dutch study actually revealed that the annual direct and indirect costs for patients were €1,501 and €5,659 respectively, and the high financial impact of the disease resulted from cost related to healthcare, to utilization, absenteeism, and lost work productivity. Well, to tell us more about CRSwNP, I've assembled a very august panel of experts to help me and to guide me through this condition. So let me introduce them to you now. First of all, I'd like to introduce Professor Peter Hellings, who is the chairman of EUFOREA. I'd also like to introduce Louise de Prins, who is a student and intern at the Department of Otorhinolaryngology, Head and Neck Surgery at the University of Leuven. Also, Nele Claeys, who is the co-chair of the Patient Advisory Board of EUFOREA, and Professor Wytske Fokkens, who is EUFOREA CRSwNP Expert Panel Lead and EPOS Chair. And last, but by no means least, I wouldn't leave you out, it is Thijs Teeling, who is co-chair of the Patient Advisory Board of EUFOREA. Let me start with you, Peter. When you talk about respiratory diseases, I'm not sure that CRSwNP is the first thing that springs to mind. So I suppose that the first question is, what exactly are nasal polyps?
Thank you, David. I think this is a relevant question on this Global Awareness Day on CRS with nasal polyps. Nasal polyps are actually structures within the nose and the sinonasal cavities filled with inflammation. And due to these structures in the nose and the sinus cavities, these patients suffer from symptoms that are well known to them, which are smell loss, headache, facial pain, nasal obstruction, and secretions. So these patients do not experience a life-threatening disease like patients with severe asthma or patients with severe chronic bronchitis, but they do suffer significantly because of the major impairment in their quality of life. Because many patients tell us that they not only lose their smell, but they also lose their taste capacity, and some even have reduced hearing capacity because of the comorbidities like middle ear problems and other problems that are close to the sinonasal cavity. So in the end, it's a bothersome condition where middle-aged people suffer from significantly, and for which we try to do our job with EUFOREA, which is trying to implement optimal care in daily practice.
I was going to come on to that, but just in terms of the way that you treat this, and I love the way you said bothersome, because I think that's absolutely right. Just outline for us how you would tend to treat patients with this condition.
Well, there are international guidelines which are very simple to understand, which are all about providing patients the treatment options like nasal douching, corticosteroids, either in a nasal spray or a gel or an oral formulation, or sinonasal surgery. And since recently, we have a novel opportunity of treating these patients also in a non-surgical option, which is elegant, and which are the biologicals that we have nowadays.
I know, it's exciting stuff, isn't it? So let's start with EUFOREA. Why did you feel the need to create EUFOREA? Obviously, there was a need. You wanted to do something about it. Tell us about that.
Well, EUFOREA was created by, by a group of international experts, all feeling the need for joining forces in order to improve healthcare in patients suffering from chronic respiratory diseases. Because we know that many organizations work in silos and only focus on lower, upper, or other disease areas in the body, and EUFOREA felt the need to try to join forces with the different stakeholders involved in respiratory care, being pharmacists, primary care physicians, different specialists like pediatricians, allergologists, ENT doctors, pulmonologists, as well as the patients. And we are very proud to have installed a very active patient advisory board with Nele and Thijs being present here today as representatives of this patient advisory board.
Well, I was going to say, I mean, it's really extraordinary, you know, and obviously having worked in medicine, it's extraordinary to see an organization where everyone talks to each other. Isn't that the way that all disease modalities should be treated?
It's like you say it, David, and in the end, all of us feel very euphoric about the developments of EUFOREA.
Very good, Peter. I like that. So tell me about the patient advisory board. You sort of alluded to it then. And clearly, the patients are the center of all of this, aren't they?
Well, indeed, patients highlight the shortcomings of the current care pathways. They join us in the development of new guidelines. They join us in the discussions on novel criteria of care and how to improve care. And, well, I leave the word to the patients that are present here to go and build further on their experiences in this patient advisory board.
Well, just before I let you go, so clearly the patient advisory board has done some really great stuff, some really valuable contributions to the scientific community. These two recent publications written on the unmet needs of CRSwNP and also this quite significant amount of comorbidities. I suppose what gives this enormous sort of credence is the fact it is coming from the patient themselves. So therefore, it means a great deal.
Indeed, I couldn't agree more. Documents coming from the patients highlighting the shortcomings of the current care pathways and how to see how they would recommend improvement of the current care pathways is really very valuable. And we are proud of being able to work together with the patients of the Patient Advisory Board in having this document launched. And just last week, we got a green light for the publication of the latest publication, which is the white paper on unmet needs of patients suffering from type 2 inflammation, not only focusing on CRS with nasal polyps, but also including asthma and atopic dermatitis. These diseases have underlying similar pathophysiology, and it's good to bring together patients from these different horizons and join forces with them.
And just for the moment, my final question to you. How do physicians tend to react when this data comes from the patient? Do they listen to it?
We hope physicians listen to it. I think patients are more excited about these activities than the ordinary physician, but health policymakers take into account very seriously these documents because it helps them to understand better the disease and also the unmet needs coming from the patients.
Thank you very much indeed, Peter. Now, Louise, I want to come to you next. Now, Louise, you are an ENT resident at the University of Leuven in Belgium, and you're also co-author of the Patients' Unmet Needs in Chronic Rhinosinusitis Care, a patient advisory board statement of EUFOREA. Now, Louise, I was struck that this contains some very personal statements, didn't it? Were you surprised by that?
First of all, I would like to thank all the patients who allowed us to interview them. It was a real honor to witness sometimes very touching and intimate testimonies. And as a medical student, we learn a lot about different treatment options and the pathophysiology of chronic rhinosinusitis with nasal polyps. But to be honest, I never really considered the impact that this disease could have on the patient's quality of life. And in that regard, I was a bit surprised by the results. I think CRS with nasal polyps and comorbidities like asthma and respiratory allergy and so on can cause a range of very severe and uncomfortable symptoms that aren't always recognized well. And by conducting these one-to-one interviews, I realized that this is not just a physical problem. And I think that indicates the importance of this publication.
So I suppose that's a great medical student answer in that you were looking at it very much from a textbook position. And then when you met real patient, you realized that actually things were slightly different.
Yes, this was so valuable. because we can learn so much from the patient's perspective to improve future care.
And were you surprised by the way that the patients were engaged? The fact that, did you find that the patients actually wanted to be involved, they wanted to make a difference, they wanted to improve their own care?
Yes, they argumented things that I never really thought about. So yes, it was very enlightening to do this.
So you definitely learned a lot.
Yes, I learned a lot about it.
Very good, very good. Well, let's now move on to the Patient Advisory Board, and I'm delighted that we have two members of the Patient Advisory Board here, Nele Claeys and Thijs Teeling. Very good to see both of you. It's wonderful to meet you both. Now, you've both been very active members of the EUFOREA Patient Advisory Board from the beginning. Nele, perhaps I can ask you first. Why did you decide to join?
Thank you, Dr. Bill. I'm glad to be here. I think more attention and research is needed for the treatment of CRSwNP and asthma. I have suffered from upper airway infections since I was 15. When I have an infection, it affects my lungs because I also have asthma. I have many infections because I also have an immunity problem, so it's a vicious circle. The infections are very difficult to treat and I need more and more medicine to recover. I take more than 10 pills every day. All this also affects my financial possibilities, my social life, my job, and so many other things. I'm tired of living without smell and taste and a blocked nose. The only times I can smell is when I am on corticosteroids. When the medication stops working as it should, surgery is required. Over the past 30 years, I have had 5 sinus surgeries. Each time they become more risky. I hope that in the future, patients can be diagnosed more quickly and receive better treatment. That is why I want to be part of the EUFOREA team.
And have you enjoyed it?
Yes.
Being part of it?
Yes,
Good.
of course.
And you feel that you're actually being able to educate the physicians, that you're making a difference?
Yes, I think so. I hope so.
I'm sure you are. Thijs, let me come to you. Same question to you, really. Why did you get involved? And really, tell me about your journey.
It's a long journey. As a kid, I always had a snotty nose. But the doctor said, well, that's part of life and you have to live with it. Sometimes I get some difficult medicines to treat it, but it's over the counter. What I later on found very bad. It's difficult with breathing. Sometimes no smell, but I accepted it. It was my burden. Then something special happened when I was 52 years old. I all of a sudden lost my conscience and was taken up to the hospital, and it turned out I had severe asthma. And that was strange because I was doing sport at a high level. I had a very good lung capacity, but it turned out that there were some problems over there. And then the pulmonologist said to me, what you should see ear, nose and throat doctor, and there's only one person in life you can manage. I asked the name of this man, and she said, no, it's not a man, it's a woman. And that, and so I was sent to another university, very funny, from one university to the other university, and that, from that day, changed my life. I have underwent totally 6 surgeries, and the last surgery I cannot remember anymore because that's such a long time ago, because then we decided also to work on biologicals, and that changed my life totally. And then, I mean, positive.
So I was going to ask you, though, in terms of the way that your family and friends perceived your symptoms, did they sort of underplay it? Did they sort of say to you, oh, I'm sure you've just got a cold, you've just, you're over-exaggerating your symptoms?
No, it was even worse. My mother-in-law worked for and was assistant with the ear, nose and throat clinic, and also wanted me to have surgery, which I, of course, resisted, because if your mother-in-law wants something, you don't want it. But at the end, I got surgery. And I think I should also answer your question why I joined the board. I wanted to do something back, because now, when after so many dramatical years, because you ask what are polyps? For me, polyps are a burden. A very, very unpleasant burden. And now I can do everything. I have no problems anymore. So when I was asked to join APOS, as a patient, well, I wanted to run away in the beginning because I had no clue what they were talking about. It's, I know something about medical, but I'm not a medical doctor. But then I found out that the physicians were really interested in my experience as a patient. That was for me more or less new. I think in the past, never a doctor asked what I thought. It's, I think, and that's a good thing of EUFOREA, that we can talk to the physician, but also talk to other patients. Do not underestimate the effect, because then you learn, one, you're not the only one. Second, there are people who have totally other symptoms, and maybe you can help each other.
And so when you talk to other patients, what do you hope the future will be, given that you're talking more between yourselves, you're talking to physicians?
I hope I can advise them to follow the proper way, not grabbing to over-the-counter medication, which only suppress the symptoms, but you know, it coming back again. See the right doctor, and hopefully also in educations of the doctors that they know how to handle it. Because I also had my physician at home who had in the beginning no clue where I was talking about. He said, okay, it's a cold.
And that was what I was alluding to earlier, the fact that I think many physicians in primary care may underdiagnose it. They
Absolutely.
may not know where to send you.
Absolutely.
Okay. Let me bring in Professor Wytske Fokkens. It's very good to meet you as well. Now, clearly, you've been instrumental in the European position paper, or EPOS 2020. Why did you decide to do that, and what did you hope to achieve? Why did you decide to do that, and what did you hope to achieve?
Well, the European position paper on rhinosinusitis is already an initiative that started in 2005 with the first version, and 2020 is the fourth version. And what it implies is to gather all the available knowledge of the moment, and that is knowledge from all stakeholders, not only the physicians, but the basic researchers, pharmacists, people from pharmaceutical companies, patients, together all to have all the available data, and in discussions find the limits of our knowledge at the moment, and then advise colleagues and patients all over the world to imply that knowledge to have optimal care for our patients.
So how has that impacted patient care? Because clearly, once you've got this, you then want to disseminate it and ensure that everyone is actually carrying out exactly the same instructions.
Yeah, well, EPOS is used all over the world by physicians. We have a large group of contributors from all over the world, and they all go into their own countries. Of course, the leadership of EPOS is traveling all over the world, but much more important, the people who actually live in their own country go there to educate their colleagues, to educate their GPs, to educate patients. We have an EPOS version especially for patients, to help them also to educate them to go to their physician, to ask for the right things. So we hope from both sides to improve care.
And what's been the response from the other physicians? Have they been accepting? Do they like it? Or has there been pushback?
No, I think in general, physicians are very welcoming, are helpful for the help we give them, and it's very well accepted all over the world.
And EPOS 2020 has also been incorporated into a pocket guide, hasn't it, to make that information understandable, discernible, and actually in a format that people can take away.
Yes, yes. There is
and that's been important?
There's a short executive summary for people to read, and of course the whole document is not to read, it's to study certain aspects you want to know. But I think very important also is the version for patients, to educate patients in their daily life and how they, because it's not, a physician sees a patient a few times a year usually, if they're lucky, but they have the disease every day. And I think a very important part of a chronic disease like chronic rhinosinusitis with nasal polyps is that patients really understand what the disease is about and how they can make their life the best as possible in their own daily care.
Yeah. Peter, we heard from Wytske there talking about a pocket guide for patients. Now, EUFOREA is about to launch a pocket guide for physicians as well, isn't that right?
That's indeed work in progress, where we try to join forces with Wytske Fokkens, with also our colleagues from the US, trying to find more harmony across initiatives and also try to sometimes simplify also messages. So I think this is work in progress, but we are nearly there to launch a new algorithm, a new pocket guide, where we try to simplify also the storylines and to make sure that both patients, as well as primary care physicians and pharmacists, also understand the key pillars of care for CRS with nasal polyps.
Yeah. And of course, that's really important, isn't it? So you get standardization of care across all specialities, across all countries, and everyone is sticking to the same guidelines.
Because that's indeed a frustration that we hear from our patients, that they go to the immunologist, allergologist, respiratory care physicians, sometimes pediatricians, and also ENT doctors, and they get sometimes confusing and sometimes contradictory messages and advices. And therefore, EPOS has made it very clear what is evidence-based and also what is not recommended and not evidence-based. So it's a very valuable document, and you could go even one step further, and I think more trying to simplify the treatment recommendations, because in the end, we don't have that many treatment options for our patients with severe CRS with nasal polyps, as we all know.
But what I think has come across from this today is just the symbiosis, the fact you've got clinicians working with patients, patients advising clinicians as well, and coming together actually means that you actually get really powerful information and improving patient care, which is the aim, isn't it? Well, thank you very much to all of our panelists for taking part. Now, you can find more information about chronic rhinosinusitis with nasal polyps, and you can also learn how you can support EUFOREA through scientific research and education for both physicians and patients alike. If you want to get involved, please visit our campaign page, which you can find at the website, which is www.euforea.eu. But for the moment, from all of us here, thank you for watching and goodbye.